name's Liv. I am a technician here in the ER at Dove Lewis. I am going to be performing a jugular blood draw on Wrigley here. She has some neurologic issues, and that's why she kind of looks like this. But because she's been really protesting our medial saphenous blood draws, and she's not perfusing super great, we're going to go ahead and do a jugular blood draw to get that blood that we need. So the main idea for at least like the restraint of a patient getting a jugular blood draw, there's a lot of ways you can do it, but for this kiddo, I'm going to have my restrainer kind of hold her head up nice and high, like her chin up like this, and then I'm going to have Tara here. We're going to hold her kind of over the table just a little bit, just so we can stretch her legs out like this. And so then that's when I'm going to go ahead and palpate for my vein. That can help with being able to find it pretty easily, having it where the skin's a little taut, and you can kind of poke without feeling like you don't know where your needle is going, because that could be a risk for something dangerous or harmful to the patient. So we're going to go ahead and start with getting this restraint going. I'm going to have Dr. Halverson hold her head up, and then, yeah. Tara's gonna hold her legs down, just like that. Good girl. I'm gonna have you hold her head up just a little bit. Don't be afraid, as the person drawing blood, to kind of adjust your restrainer to where you would like them to be based on how you think you'll be most successful with the blood draw. Right, so we have our trachea right here in the middle. You can feel the rings. You're gonna have a jugular on either side of the trachea. Sometimes a little more lateral, sometimes it's a little bit more medial. With cats, it really can vary. A lot of times I notice that they're a little more lateral. And so I'm going to put this collar up for you to hold on to. And then we've got our thoracic inlet down here, right? And so if I was going to be going for the jugular on this side, which is what I'm going to do, then I'm going to be pressing against this thoracic inlet to help hold off the vein so it pops up and I can actually get blood once I am in the vein. So I'm going to stick my thumb in here. Some people do it right in the thoracic inlet like this. Some people like to kind of hold above it. I like to hold above it. I do find that that makes it a little bit easier to kind of pop that vein up. I'm going to go ahead and just put some alcohol. And while I'm holding off, I'm going to feel for the vein. If I'm initially not feeling it, sometimes what I'll do is I will push. Oh, I'm sorry, honey. I know. I'm going to kind of push back and forth to see if I can feel it popping up. Sometimes that helps with palpation. Okay. All right, so I think I feel it right here. So I'm gonna go ahead and poke. I generally will not use a butterfly for jugular blood draws. So I'm gonna use a 22 gauge needle with a 3 ml syringe. I'm gonna go ahead and take my needle off. All right. Bevel up as always. Okay, so I'm gonna go in and poking. Okay, we are getting blood. I'm gonna go ahead and fill my entire syringe. Good girl, Wrigley. Good girl. All right. First thing you do is hold off before you take your needle out, and then you'll have your restrainer hold off for you, like that. And so that I can put this in my blood tubes. Another thing to point out when you are filling multiple blood tubes, especially with different additives in them, any blood tube that does not have any additives is what you want to, or not that doesn't have any additives, but you want your EDTA tube to be the last tube that you put blood in. You don't want to risk any kind of cross-contamination with the other blood samples. So I'm always going to put my blood in here first, my serum separator, and then I'm going to put it in my EDTA. This is the one that I want to invert back and forth so that I don't get any clots in my blood and it stays anticoagulated for it to go to the lab, okay? This one I'm going to hold upside down. I'm going to give it about 10 minutes to clot, and then I'm going to spin it in a centrifuge to give me some serum to send to the lab. Thanks for watching.